Hello, I'm Carolyn Beauchamp. I'm President and CEO of the Mental Health Association in New Jersey. And today we are going to present family empowerment for families who have adult children with a mental health and a substance use disorder. We have a panel with us. I want to introduce my colleagues, Tanya and Joyce. Joyce?
Hi, I'm Joyce Benz. I'm the program director for a program called Intensive Family Support.
Hi, I'm Tanya Ahern. I work with family advocacy and government affairs.
Why don't we start with what is family empowerment? I want to throw it open to you ladies.
I think family empowerment is helping families to learn about mental health issues because these issues not just affect the individual with the diagnosis, but the whole family. And so it's helping them learn about the illness, about resources, coping strategies, and it's giving them a voice. It's helping them to advocate for their loved ones, and it's helping them learn about options.
Thanks, Joyce. Tanya?
Many of the families that we are working with come to us in crisis. And so this gives us an opportunity to educate them, because very often they don't get that education. And this is something that we don't learn as a family member, especially a parent. We don't learn these skills. So when we educate the family and we give them tools and help them so that they can keep the lines of communication open with their child, and also understand the process and the resources available and how to take care of themselves, because that's a very crucial part, is that they are well. And that does help with the overall family recovery.
So I guess one of the things we're saying is that certainly right now, families are not really included in treatment. You can have young adults or middle-aged adults who are hospitalized for mental illness, or perhaps in a residential program for substance use disorder, and the family really has no experience with that. Our system tends to frequently blames families for being at fault, and doesn't really spend the time to educate, include them, and help them be better at dealing with these kinds of crises. And that's pretty much where we come in. Let's talk a little bit about what we provide here at MHA&J. Joyce, would you start?
Sure. So intensive family support, I provide services in Union County. The Mental Health Association also has a program in Atlantic County, but there's a service like ours in each county. And our role is to be a support to families for as long as they need. We provide education. We help them get linked to needed resources. We have a family support group. We have a sibling support group. And we help families to navigate the mental health system. The mental health system, there are a lot of services out there, but it's kind of a fragmented system. And our role is to sort of provide that roadmap.
And how long do people stay connected with you?
It can be, sometimes people just come to ask, for a brief time to learn about a particular resource. Some families we have worked with on and off for a number of years. So it's open-ended based on what the families want and need. And all of our services are free, so people don't have to feel burdened, that they can utilize the service.
That's so important. Thank you. Tanya?
So we have a call line for families who are struggling with substance use, and that's an NJ Connect call line. And through that call line, we can get families to our family groups, which we do twice a week. Also, we can connect them to other resources for the individual. When they come to a family group, like I said before, a lot of times they are in crisis. And so it gets us an opportunity to let them see that other family members are going through the same kind of thing, because often we think we're the only ones that are feeling these feelings, that are going through what they're going. So not only do we have families who are already in recovery who come to this as just as a support, ongoing support, but we have those new family members who learn from the families in recovery. It's a different approach that we use. It's very compassionate to the individual, because sometimes we may be compassionate to the families and forget about the individual. So it's kind of a combination. So I found that when families come in, very often they don't tell anyone, they isolate, and they don't tell other family members or friends or neighbors about what's going on, because there's so much stigma around substance use. And we become a family, and they are their supports. And they may not come, they may come 4 or 5 times. They may come just when they need us. It doesn't matter. Like Joyce said, it's all free. They're open to come anytime they want. There's no commitment on their part, and I think that's helpful.
Could each of you give a couple of subjects that come up in your groups? A couple of the things that you have to deal with?
I mean, it can be as specific as learning about how to apply for Social Security or about a particular diagnosis, but a lot of it is learning to sort of navigate the mental health system. Lots of times people only know about a particular aspect of the system. They may not know that there's things like case management. And we also do encourage families to do sort of future planning, because a lot of our family members, as they age, there isn't sort of a plan as to, who will be there to support their loved one when they're not able to.
Very important. Tanya?
Family members, I think one of the things that's really hard for them is all the mixed messages on how to deal with someone in the family that's struggling with substances. And these mixed messages come from other types of supports, or from even treatment, people in the treatment field. And so we spend a lot of time talking about things, other ways to handle situations, other resources to, if a family member can't live in your house, what's safe housing for them, or what are the options to keep them well so that they're not in danger of overdose, as much as you can protect them from that. But what other options are there, and that we don't have to just throw somebody out because they're not doing well. The other thing that comes up a lot is medications, medication assisted therapy. So there are people that don't believe that medications are recovery. And so we educate the families on that as well, because sometimes we get someone on medications and they're doing well, and the family is convinced that they're not in recovery because they are on those medications. So that's a big education piece. A lot of it is just getting rid of the stigma and understanding this is my child, this is my family member I love, and that they can get well.
It's an opportunity for people to sit with others who have similar problems and voice their feelings and learn different ways of coping. We're all about helping people see what their choices are. So if this is helpful to you, we're very pleased, and we'll be showing you some of our resources if you'd like to be in touch, and we can be helpful to you. Thank you so much. Thank you, Tanya. Thank you, Joyce.